Good morning. Today, St. Louis County will ask service providers, advocates, clinics, and hospitals to submit proposals to address our ability to impact domestic violence in our community. $1 million of CARES Act funds will be set aside to prevent domestic and social violence. This will be used for expanding social services through technology, to make shelters safer, and to raise awareness of the services that are available. And we're asking them to act quickly. The grants will come from approximately $24 million of CARES Act funds set aside for humanitarian programming and humanitarian relief. This pandemic has kept people at home. And all that time at home can lead to isolation. And we know that isolation can make those in abusive relationships more vulnerable. They can be unable to continue a regular routine of leaving the house for shopping or to visit friends and family. And that means more time alone with an abuser and less time to seek potential help. And service providers and advocates for those in these relationships say that not being able to leave home or to not have time alone to call and seek help can increase the magnitude of abuse. And during a pandemic, there are factors that make an abusive situation more prevalent and more severe. Stress, economic anxiety, job loss, all can lead to increased tension in the household and increased alcohol consumption. And then a lack of resource to the courts for such things as emergency orders of protection can be challenging. The 21st Judicial Circuit has been great at making teleconferencing services available to make sure that victims can get access to orders of protection when they need it. And the County Council has helped us by passing legislation to prevent domestic abusers from keeping a concealed and carry permit. Shelters for those who have been abused have faced challenges during COVID-19. Some shelters have had to close or to reduce capacity due to concern for those living in crowded situations. And then some victims have been hesitant to access shelters out of concern of living in those crowded situations or out of concern that they may catch the virus. So we're asking existing agencies and advocates to respond quickly to this request for proposal so we can be better prepared as this pandemic continues. We know that the COVID-19 infections are increasing in the community, which could, of course, continue to slow our reopening plans and lead to more people in isolation. The request for proposal is now available at stlcorona.com, and we urge those advocates and agencies who are interested to apply quickly. And I would be glad to answer any questions.
Have you heard from county police about an increase in the number of domestic violence calls out to homes?
We know that those are increasing. I don't have the details, but we have heard through various agencies and advocates that the calls to their helplines are increasing, and those are what we are following more than the calls to police. That's a better measure of need in the community. But we've been in close contact with advocates, and we know that we need to provide more services. We also know that the factors that lead to more concerns for domestic violence, those factors are growing in our community. Isolation, inability to leave the house, inability to see friends and family, and then on top of that, a reluctance to access shelters out of concerns of living in crowded situations. So St. Louis County knows that we need to put more resources into this to expand those shelters, expand those resources, expand technology for people to have access to these resources, and to make it more well known what resources are available.
Can you talk a little bit on Wednesday? You had said that you are watching the numbers every day and have looked at, putting back some restrictions in place because of increasing numbers. Where do we stand right now? And can you give us some perspective on why you are waiting to not put those restrictions in place? Because we talked about St. Louis County being so proactive in the past.
Right. No, I think we're talking about that, and we want to maintain that forward position because it's left us in a better place. but we do see the numbers increasing. Our goal was to be able to test 1,500 a day, and from the report yesterday, we had 2,300 tests, and we have a 6% positive rate for a weekly average. It's difficult to process these numbers because of the reporting variances. Sometimes we get several hundred tests sent to us in a bundle that had been waiting to be reported from an outside testing provider, and that clouds the data a little bit. But we're watching these trends very closely. We're talking with the pandemic task force on a regular basis, almost on a daily basis, to make sure we have guidance. There's an increased effort in the community to make it known, more widely known and more widely accepted even beyond St. Louis County, that masks are critical moving forward, and it is our best weapon to turn the tide on this. But we are talking about more restrictions. We're considering more restrictions. The hospital admission rate is getting close to that 40 admissions per day mark that we had set several weeks ago as the point where we would start talking about more restrictions.
And that 2,300 tests was over the weekly average.
That is tests per day, and that is a weekly average. Yes.
Do you have, could you go into more detail about where we are standing with the shelters? Do we know how many have closed, if there's a overcrowding in those shelters? Just more detail about
Well, there's not overcrowding. In fact, there's some hesitancy to access the shelters over concerns of crowding. So we have some other ways to expand capacity. We can put people in a hotel if we need to. Folks are worried about that, especially if someone is needs to be quarantined or has other concerns. We have resources to do that, and we want to make sure that victims of domestic violence have full access to those resources, and that there aren't any financial reasons to prevent them from receiving services. We're making an investment here because we know there's a need. We know that need for domestic violence services is going to increase. It does during the pandemic, it does during times of isolation, and it increases when victims don't have their regular routine to get out and move about and visit with their support network. So we need to put some resources here, and we're planning to do that, and that's why we need our advocates and agencies to respond quickly to these requests for proposals.
Dr. Beecher, I'm just trying to kind of wrap my head around what has happened with the numbers in the past week or so. I think last week when I was at one of your briefings, you were talking about how we were still in a good place, how St. Louis County had been a model for other places. We'd shut things down early and we were doing well. And then all of a sudden, Monday, I'm seeing the reports about the letter that we're getting from, or the call that we're getting from the White House about needing to take aggressive action and being in a bad place. So what has happened in this short period of time?
Well, I think what you'll see is that the numbers are increasing, as you would expect with more people out and about. We've had some reporting delays. We have a lot of different people performing tests in St. Louis County, and the report of those tests to St. Louis County had been delayed significantly. And the delay of that reporting is really because of the massive testing that's going on in our country. We have increased testing in the southwest, in the southern United States, and then on the West Coast. And we're also seeing that wave of increased cases in the South moving up into the Midwest, and that puts pressure on our community. And then we're seeing an increase across the state of Missouri, and where that puts pressure on St. Louis County as well. So we have pressure from outside cases increasing, putting pressure on the county. We have cases increasing in the county. We have not yet widely adopted masks, but we're working very hard to get people used to the mask mandate. And then we have to recognize that any intervention that we make, whether it's masks, stay-at-home orders, social restrictions on businesses, any intervention we make, it takes 2 to 3 weeks to see the benefit of that intervention because of the 14-day incubation period of the virus. So there are a lot of factors here. It is growing in St. Louis County, not as fast as it is in the state, not as fast as it is in the rest of the country, but it is growing here. And the intervention we made a couple of weeks ago in mask has not yet had time to fully mature. We do not yet have everyone in St. Louis County wearing a mask. And then we have pressure on the testing system, and we have delayed reporting of tests because of the system is just strained across the country.
Are you frustrated? Where's your head at with all this?
Well, I mean, it's frustrating for everyone to be living in a pandemic, which is a 100-year event. It's you know, floods are frustrating, natural disasters are frustrating. We've got to be focused on our goal. And I feel badly for kids who may not be able to, you know, be in school or may not be able to have a full youth sports experience in school this fall. I have a son who's very competitive and high school athlete, and he's going to have a different experience this fall for sure. And it's frustrating for him. It's frustrating for parents to try and find an alternative way to take care of their kids when some of the services that are usually available are disrupted because of a pandemic. But we have to stay focused on our goals. Our goals are to protect the health and welfare of everyone in St. Louis County, and then build from there to keep our economy going, to try and keep things as normal as possible. But we have to focus on control of the spread of the virus. Everything will move off of how well we control the virus. Our economic opportunities moving forward will depend on how well we control the spread of the virus in our community.
For those school districts who have yet to come out with a finalized decision on how they'll approach the fall semester, are you suggesting that they would consider online only based off of the numbers that we're seeing right now?
Well, I've been saying now for a week that parents should choose virtual option whenever it's available. But with the trajectory that we're currently going right now, it will be very difficult for schools to have in-class teaching in the next 4 weeks. 4 weeks from now, that will be very difficult. We're not at the point yet today where we would say that it's certain, but I can, just looking at this trend for the past few days, we'll watch it through the weekend, but as this trend is going, it will be very difficult for schools to have anything other than an all virtual curriculum. But we have to look, we have to recognize that there will be students with special needs. There will be students, children of first responders that will need a plan, and children of nurses and doctors and other folks that need to be there on the front line. And we have to work as a community to find a way for those kids to be taken care of so their parents can take care of us.
Evictions can start back up soon. How do you expect that to impact the county?
Well, we have directed $10 million of COVID relief funds into rental assistance and assistance for low-income and moderate-income families. And those agencies are in the process of receiving applications and supporting folks that are struggling to pay their rent. And we do believe that that infrastructure is there, and we appreciate the patience of landlords while we work through this. They can't, they have their own difficulties as well, and we hope that the programming we have provided will keep people in their homes. We definitely do not want to see people losing their apartments and their homes, and we're going to continue to work towards that effort.
What's the best way for people to apply for that assistance?
I would start with stlcorona.com, and we'll make sure information is available there. But there's a pretty deep bench of resources, testing, services, programs, and opportunities for help. Doug, any questions?
No.
Okay.
Thank you.
Thanks a lot. Let's get the word out. People need help.
So this is from KMOX.